What if a diabetes drug could change the game for heart failure treatment? New research is suggesting just that. We're diving into SGLT2 inhibitors, a class of medications that could revolutionize how we approach heart failure with preserved ejection fraction, or HFpEF. A major meta analysis from the University of East Anglia, published in the European Journal of Preventive Cardiology, looked at 5 large clinical trials involving over 9,700 patients. The aim? To see if SGLT2 inhibitors, originally designed to lower blood sugar, could also reduce death and hospitalization in heart failure patients. These drugs include empagliflozin, known as Jardiance, dapagliflozin, sold as Farxiga, ertugliflozin, known as Steglatro, and sotagliflozin, recently approved as Inpefa. They were tested in some of the largest heart failure studies to date, like Emperor Preserved and Declare TIMI 58. The findings were impressive. Patients taking these medications had a 22% lower risk of cardiovascular death or hospitalization for heart failure compared to those on a placebo. And when we focus just on hospitalizations for heart failure, that reduction jumps to 29%. These numbers translate to real-life benefits: less time in the hospital, fewer emergency visits, and an overall better quality of life. What's even more groundbreaking is that these benefits were observed in patients with true HFpEF, where the heart's ejection fraction is over 50%. In that group, there was a 23% reduction in the combined risk of cardiovascular death or hospitalization. This is the first time any class of drugs has shown consistent benefits in this challenging condition. Now, let's be clear: these drugs didn't significantly reduce overall death from any cause. HFpEF is still a complex disease, often intertwined with diabetes, obesity, kidney disease, and hypertension. But the reduction in hospitalizations and heart-related deaths is a crucial first step. So, how do these diabetes drugs actually help the heart? Researchers believe SGLT2 inhibitors provide a multifaceted benefit. They act as mild diuretics, helping the body eliminate excess fluid. They improve heart muscle metabolism and efficiency, reduce inflammation and fibrosis in heart tissue, and modulate the sympathetic nervous system, which lowers stress on the heart. What's truly fascinating is that these benefits extend even to patients without diabetes. Yes, people without diabetes who took these medications for heart failure still experienced fewer hospitalizations and improved heart outcomes. This is why experts are now considering SGLT2 inhibitors as heart drugs, not just diabetes drugs. Looking ahead, a large trial called Deliver, which includes patients without diabetes, is expected to shed even more light on this topic. But for now, SGLT2 inhibitors like Jardiance, Farxiga, Steglatro, and Inpefa represent the most promising advancement we've seen in HFpEF in years. The quest for an effective medication for HFpEF has been long and frustrating, but as researchers put it, with SGLT2 inhibitors, the destination is now visible, and Ithaca is closer than it's ever been.